Chapter 6706. The private doctor blurted out. Don't you know that Mr. Hank waited for an abnormality all night? Dr. Johnson was stunned. Waiting for abnormality, what does it mean to wait for a whole night? Is Mr. Hank looking forward to his body showing abnormality? The private doctor smiled and said, You are right. Mr. Hank just wants his body to show a little abnormality. There is nothing abnormal, which seems to make him more anxious. God damn. Dr. Johnson pushed his glasses and said awkwardly. But Dr. Hank would not expect his CA-199 index to be abnormal, right? The private doctor, who was smiling just now, was stunned for a moment. After a moment, he came back to his senses and blurted out. What CA-199 index are you talking about? Are you kidding me? As Hank's private doctor, he knows all kinds of important physical indicators. CA-199 is a carbohydrate antigen, also known as a tumor marker. There are many kinds of tumor markers. And different tumor markers often correspond to tumor problems in different parts of the body. In most cases, if a person does not have cancer cells in his body, all tumor markers must be within the normal range. Once a tumor marker is abnormal, there is a high probability that the patient can be diagnosed with cancer. Of course, if tumor markers are abnormal, it does not mean that there is cancer 100%, but the probability is also very high. Especially CA-199 is related to digestive system cancers, such as pancreatic cancer and gastric cancer, and it is extremely sensitive. Once this indicator is abnormal, there is a high probability that it is digestive system cancer. So he quickly asked, What is Mr. Hank's CA-199 index this time? Dr. Johnson hesitated for a moment before saying, 628. What the H3LL did you say? The private doctor felt dizzy. The limit of the normal value of CA-199 is 37. If it exceeds this value, it means there is a problem. And the greater the proportion of exceeding this value, the higher the probability of a problem. Hank's CA-199 index soared to 628. According to his experience, this is basically pancreatic cancer. So he quickly asked, Mr. Hank, what was the CA-199 index 3 months ago? Dr. Johnson said, 3 months ago, it was 12. The private doctor wiped the cold sweat. It's only been 3 months. And it has skyrocketed dozens of times. This is too fast. Johnson nodded, it's really fast. But it's not exaggerated for pancreatic cancer. Some patients develop very quickly and die in a few months. In this way, Mr. Hank is not the fastest developing group. At most, he is above average. FCUK, the private doctor asked nervously. Should we do a whole body scan to confirm the size of the lesion and whether it has spread? Confirmed. Dr. Johnson said, Do you want to tell Mr. Hank, or should I tell him? Explain it clearly to him. After obtaining his consent, we will immediately arrange for a nurse to inject him with a contrast agent. And then we can arrange a whole body scan. I'll go and tell him. The private doctor murmured, If you go, I'm afraid he can't bear this blow. After that, the private doctor hurried back to Hank's ward. At this time, Hank was lying in the group, talking nonsense with his friends. Seeing the private doctor coming back, he smiled and asked, How's the situation? The private doctor didn't know how to tell him for a moment, so he coughed awkwardly. Mr. Hank, there's something wrong with one of your indicators. Ouch! Hank was instantly happy, got up from the bed, and asked with a smile. Which indicator is wrong? Tell me quickly to make me happy. Chapter 6707. The private doctor was extremely embarrassed. He really couldn't understand what medicine Hank had taken wrong. And why he was always hoping for health problems. Thinking of what he said just now about the saying, he suddenly said with some shame, "Mr. Hank, I want to apologize to you. Now I feel that what they said seems to make some sense. There may be some phenomena that cannot be explained by science. It may be what they call metaphysics." Hank nodded and said in agreement, "The world is inherently diverse. Each of us can only see a part of it. As for the invisible part, we are still very ignorant." As he said, he waved his hand, "Let's not talk about this. Let's talk about business. What's wrong with me?" The private doctor hurriedly said, "Your CA-199 index is a little too high." Hank asked expectantly, "What is this CA-199 related to? By the way, does it have anything to do with S3 Zool ability? I don't seem to be very good in that aspect recently. Could it be related to this abnormal index? S3 Zool ability." The private doctor was confused and explained, "Mr. Hank, this index has nothing to do with S3 Zool ability. It is related to digestive tract cancer. And the relationship is very close." "Shit!" Hank was stunned and blurted out, "What do you mean?" "You mean, my digestive system cancer indicators are abnormal, right?" "Yes." The private doctor summoned his courage and said, "Not only are they abnormal, but they are extremely abnormal." Hank was shaking with nervousness and asked anxiously, "What do you mean? Explain it to me clearly." The private doctor explained, "It means that you are very likely to have digestive system cancer. And the probability of pancreatic cancer is even higher. Because your indicator has increased dozens of times in 3 months, from 12 to 628. Then, the private doctor asked in confusion, "Mr. Hank, who told you that you might have pancreatic cancer? This person is so amazing. How did he make that judgment? Oh my God." Hank turned pale with fear. He asked him, "What do you mean? Do I really have pancreatic cancer?" The private doctor said, "We can't be 100% sure yet. I just communicated with the attending physician. He means to do a whole-body scan for you as soon as possible to see if there are any clear cancer lesions in your body. If so, we also need to see if there is any infiltration and spread of lymph nodes and surrounding tissues. If you have no objection, we will let the nurse inject you with contrast agent and start further examination immediately." Hank blurted out in panic, "FCK, I was expecting some small problems to be found out. But a big problem happened. Why the hell are you asking this nonsense? Hurry up and arrange the examination, quickly." The private doctor hurriedly said, "Okay, Mr. Hank, please wait. I will go to communicate and coordinate. In addition, you don't have to be too nervous. We have the best cancer experts here. If it is evaluated that you can have surgery today, we can perform the surgery on you immediately today." Hank cursed, "Stop talking nonsense and arrange it." The private doctor ran out in a panic. For him, Hank's health is related to his future income. Chapter 6708. If Hank remained healthy, he would continue to receive the salary. And he would also receive dividends from the hospital every time he examined Hank. If Hank has any serious health problems, a private doctor like me who is a health consultant will have to resign. Hank will go directly to a specialist hospital for inpatient treatment. By then, various experts will come for consultation. And I will have nothing to do with it. Hank's mentality was very good just now, but now it has quickly collapsed. He picked up the phone tremblingly and stammered in the group. Brothers, something seems to be wrong." Angelo teased him for the first time. "Hey, congratulations, Hank. I have been waiting for the abnormality all night. And finally I have waited for it." "What is the abnormality?" Hank was in no mood to figure out what Angelo meant by this. When he saw him say this, he immediately cursed. "Angelo, you be a five-tard. Are you cursing me to die early?" Angelo felt aggrieved. "Hank, didn't you say in the group that you expect to find some abnormalities? Why are you scolding me?" Hank roared angrily, "I am expecting abnormalities. But I only expect a little abnormality. I don't expect myself to have pancreatic cancer. Now my CA-199 has skyrocketed dozens of times. The doctor said that I have a high probability of pancreatic cancer." His voice immediately caused an uproar in the group. Everyone was still ridiculing Charlie when they were discussing in the group all night. Everyone thought Charlie was just being mysterious. How could Hank, who was so healthy, really have pancreatic cancer? Even if Hank really had pancreatic cancer, how could he tell? There was no basis for it. But now, after hearing what Hank said, everyone's perception of the whole thing immediately changed 180 degrees. Angelo said in panic, "This means that what Charlie said is right. Doesn't that prove that, except for him, no one in the world can cure our impotence?" Another person also said, "Hey. It seems that we still can't escape from the palm of the Yi surname. I'm afraid we can only pin our hopes on him for impotence." Hank cursed, "Yang, you're fucking impotence. It's time, and you are still paying attention to impotence. I don't even know how many days I can live." Angelo immediately reminded, "Hank, if you are really diagnosed with pancreatic cancer, then go back to Charlie. Didn't he say he has a way to cure you?" Hank suddenly came to his senses. "Yes, you are right. Since he is right, then he must not have lied when he said he could cure it. After I do a full-body scan after confirming it. I went back to find him as soon as possible." Angela sighed, "I suddenly have a feeling that we can't escape from the palm of Mr. Wade's hand in this life." Someone said, "But why do I feel quite safe? This man can see at a glance that the doctor has not found out the serious disease before. If he has not reminded Hank, he may delay treatment and die at the speed of light. If we can build a good relationship with him in the future, and be a dog beside him honestly, he should help us if we really get sick, right?" Angela said, "What you said makes sense. But whether it can become a reality depends on whether Hank can make Hank recover after he goes to him. If he can really make Hank recover, then there is nothing to say. I will be a dog of Mr. Wade in this life." Chapter 6709. Hank's soaring CA-199 index finally made more than a dozen people in the group realize that Charlie did have an invisible ability that could determine a person's life and death. Hank was already scared at this time. He immediately received an injection of contrast agent and was pushed into the hospital's full-scan CT room. The huge machine was running wildly around him, and the huge vibration, roar, and alarm doubled his inner panic. In the past, this advanced medical equipment was the power of technology and money for him. And it was also a kind of peace of mind. But now, this equipment makes him extremely flustered and terrified. Since this scan requires scanning a person from head to toe in a circle twice, it lasts for a long time, which is even more torturous for him. Just when he felt that he was about to suffocate, the machine finally stopped running and pushed him out of the huge ring. The lead door that isolates radiation slowly opened. The private doctor and several nurses quickly moved him to the mobile bed and sent him back to the ward. On the way, Hank couldn't help but ask, "What are the results of the scan?" The private doctor answered him, "Mr. Hank, don't worry. The amount of data from the full scan is quite large, and we have to wait for the computer to merge and analyze it. You should go back to the ward and wait. I have already communicated with the attending doctor, Dr. Johnson, and he will come to inform you in person as soon as there is a result." I won't waste time passing on messages in between. Okay. Hank nodded slightly. His inner uneasiness is becoming more and more serious. In the ward, Hank waited in bed for half an hour in despair. The attending doctor pushed the door open and came directly to Hank's bed. He explained solemnly, "Mr. Hank, we analyzed your plain scan results and found that your pancreas position was indeed obviously abnormal under the contrast agent. We called a number of experts to look at the film and agreed that it should be pancreatic cancer." Hank asked hurriedly, "Can it be confirmed through the film?" Johnson nodded and said, "The film, plus the abnormality of the CA-199 index, can basically confirm it. Of course, the final confirmation still requires pathological results. And pathology is above all else." Hank asked again, "Then what should I do next? What is the current extent of my pancreatic cancer?" Johnson said, "At present, we have preliminarily determined that it is still an early stage of pancreatic cancer. After all, the last examination was normal. From the plain scan results, no lymph node and distant metastases have been found." "That's great." Hank breathed a sigh of relief. The cure rate of early cancer is much higher. And he is very clear about this. Johnson was not optimistic at this time. He said solemnly, "Mr. Hank, pancreatic cancer itself has a very poor prognosis. Even in the early stages, we performed a total pancreatectomy. And the 5-year survival rate is the worst among all cancers." Hank asked nervously, "The worst? Not even the first place?" Johnson said, comprehensively, "It's not, it's the worst." Hank asked, "Then will my surgery be effective?" Johnson replied, "From our current perspective, we are not optimistic, because it progresses too fast. In 3 months, the indicators have doubled, which proves that cancer cells are growing at a very fast rate and are coming on aggressively. The more such cancers are, the worse the prognosis will be." Hank wiped the cold sweat off his forehead and asked him, "Then what treatment plan do you have for me now?" Johnson said, "I came here to discuss the surgery with you. The plan we are thinking of now is to intervene as soon as possible and perform the surgery to remove the pancreas." Chapter 67:10. Hank asked, "If my pancreas is removed, how long can I live?" 5 years. Not sure. Johnson said, "Pancreatic cancer is currently the most difficult to predict. Not only does it develop rapidly and is highly lethal, but sometimes even after the surgery has been completed, it may suddenly appear in a nearby organ. So it also depends on luck, but one thing is basically certain. No matter how early the pancreatic cancer patient is discovered, the 5-year survival rate is less than 10%. And the 10-year survival rate is basically zero." At this point, Johnson added, "Let me put it this way. If thyroid cancer is the Italian army during World War II, then pancreatic cancer is the German army during World War II." Hank asked, "Wasn't Hitler defeated in the end?" Johnson added, "In this metaphor, the human body can be replaced by Poland. FCUK. Hank said, "If Japan can get it, it can also take down Poland." "Yeah," Johnson said. "It's just not that fast. The speed at which Hitler attacked Poland is just like the speed at which pancreatic cancer develops. Pancreatic cancer is the Nazi among cancers. The Hitler among cancers." Hank murmured, "So even if you remove it as quickly as possible, it will be difficult for me to live for 5 years." Johnson comforted him, "Now is not the time to think about these things. The most urgent task now is to perform the surgery and remove it quickly. The sooner the better. It is best to start the preoperative examination and preparation now, and strive to perform the surgery directly within 48 hours. 48 hours? Hank asked him. Why do we have to wait so long? Johnson replied, there are many indicators that need to be tested before the operation. The simplest one is to check the coagulation problem first. And the infectious disease situation must also be checked. Moreover, before the operation begins, the surgeon team must hold a consultation to discuss and formulate an operation plan. Only when everything is confirmed can the operation be performed. Hank pondered for a long time and said, let's do this. What tests should you do? If blood needs to be drawn, draw it quickly. Didn't the film also take it? Let the doctors start studying the operation plan. I have something to do and need to go to China. I will try to come back within 48 hours. Johnson thought Hank was still busy with work, so he quickly said, Mr. Hank, you are not suitable for work in your current state. You should stay in bed and have a good rest in the hospital. No. Hank blurted out, I have to go to China. If everything goes well, I will come back in 48 hours. You don't have to arrange surgery for me. Just give me another check. Maybe I will have recovered. How is it possible? Johnson said mercilessly, China's overall medical level is not as good as ours. Their doctors are good in clinical experience. For the same type of operation, our doctors perform dozens of operations a year, while their doctors perform hundreds of operations a year. However, in terms of basic theory and the development of new drugs, we are still stronger. No one in the world can compare to us in this regard. Hank waved his hand, let's not talk about this for now. According to what you said, the medical level in the United States is the best in the world. But I only have a 10% chance of living for 5 years. 5 years will pass in a flash. You want me to die so soon, I can't accept it. I must recover. Completely cured. Johnson hurriedly said, Mr. Hank, complete recovery is impossible. Moreover, if pancreatic cancer is not intervened quickly and effectively, the survival period is basically only half a year. Hank said angrily, I didn't say no intervention. Don't you have 48 hours to prepare? Then I will go to China first in these 48 hours. No matter what, I will be back within 48 hours.